Number 2 is functional developmental stage. In pre-functioning, during the tooth bud enhancement and tooth bud stages when the root development was taking place, pre-functional, when tooth is not functional, it's not erupted, it's not in the occlusion. So that means for permanent teeth, pre-functional development of the cementum process. In the development of the tooth, during this period of time, primary distribution of the main place that it determines.
Ma'am, your voice is breaking.
Better please check your network.
Ma'am, my network is fine.
Okay.
Yes, it's breaking.
Now also it's breaking.
No, ma'am, it's fine now.
Nupur?
Yes, ma'am, it's fine now.
Perfect. I have switched on that recording option now because we need to, so that might have caused that. So pre-functional developmental stage, I'll repeat for you. It is the cementum forming stage, especially when the root development was taking place. During the human tooth roots were developing, and it is the extended time period in the development stage of the tooth, that is pre-functional cemental developmental stage, ranging in the permanent teeth from years 3 to 7 years of life. Long lasting process it is. Varieties will take place. That is determining the future periodontal apparatus as well. To talk about the functional developmental stage cementum, it is commencing when reach to the occlusal level. Now teeth has erupted. It is coming into its functional form. It is meeting the opposite arch teeth. It's in the function. Periodontal ligament apparatus to the cementum, to the continuous this cementum deposition resorption throughout the life, depending upon what forces are applying either on the distal, mesial surface, anterior or the posterior surface of the root of the tooth where cementum is present and cementocytes are there. So during the functional development, doctors, what is happening? The adaptive and adaptation for the force that is applied. For example, force is applied more towards the mesial surface. Distal aspects, more cementum will be there. That is biological responsiveness. So influencing the alteration in distribution of the cementum along the root surface at the particular period of time where force was more. So pressure was more on the anterior surface. What will happen? Cementum resorption started taking place. But once pressure or force was released, what happened? Cementocytes were recruited on that state. So this is the functional aspect. Briefly, the cementogenesis, inner enamel epithelium and outer enamel epithelium. During development of the root, they were proliferating downward, and this double layer of sheath comprising of inner enamel epithelium and outer enamel epithelium were merging out as a flat epithelial cells in a row. That row was referred as Hertwig's epithelial root of sheath. It induced the follicle to differentiate into odontoblast and cementoblast. That means which secreted the organic matrix like predentine, Odontoplast retreated inwards, then they left behind some of the waste material of so-called odontoblastic processes. There was formation of hyaline layer. Subsequently, Hertwig's epithelium of root sheet breaks off. As soon as breakage of these Hertwig's epithelial root sheath, what happened? The dentine that was laid down, that hyalinized material, vacant odontoblastic processes come in direct contact to the cells of the dental follicle, which are nothing but connective tissue cells, mesenchymal cells. Connective tissue, and hence have property to get differentiated into the lineage of cementum forming cells called as cementoblast, which differentiated further into different varieties of the cementum. Any question till here? It is easy. You have studied lot many times. We are revising it. Nupur, Panurai, Sakshi. You three are not sleeping today like last morning class. I'm so happy seeing you three indulged in the class. Huh? So next time we'll keep 8 or 9 class. Sunday morning class we'll keep. Huh? Okay. Coming on to the biochemical composition. Inorganic portion of cementum comprises of about 48 to 50%, which is mainly calcium phosphate in the form of hydroxyapatite crystals embedded with molecules of fluoride. Organic portion is comprised of more collagens and non-collagenous substances. It's about 56%. Inorganic content, then the mineral component, definitely calcium phosphate hydroxyapatite crystals are there, since we are talking about teeth. But in this, what is there? There is small amount of calcium and phosphate present in its labile form. So hydroxyapatite content in cementum, which is only 50%, is appeared to, this is very important part to remember. This can come as various MCQs in all 3 foreign license exams. Hydroxyapatite content in cementum is lesser than that is present in the bone, enamel or dentine. In cementum, hydroxyapatite crystal size is about ranging in thickness about 7 to 8 nanometer. It's about 52 to 55 nanometer wide. But these hydroxyapatite crystals, which is comprising the cementum structure, is present in the enamel. That's the microscopic differentiation. So now I have highlighted the composition. Cementum is containing 0.5 to 0.9% of magnesium ions, especially in the deeper layers. Appears to have higher content of the fluoride in the teeth, all hard tissues. If we compare, even including the bone, all hard tissues you compare, then fluoride content is highest in the cementum. Its concentration will keep on increasing in the age changes. It varies definitely with fluoride supply, geographical concentration of the fluoride ion, and nutritional status of the patient. Sulfur in the cementum composition about 1 to 3%, 0.1 to 3%, which is also constituting the organic matrix part, because it is indulged in the formation and cross-linking of the collagen fibers in the organic matrix. Cementum include cuprous, copper, zinc, and natrium, that is sodium. And these are detected at the electron microscopic analysis. So now if I am going to talk about the collagenous portion or the organic matrix of the cementum, type 1 collagen is considered to be the predominant form present in the composition of the cementum. Type 3 collagen, which is less, has high concentration due to developmental stage, pre-functional stage of the cementum, or in the reparative phase. Less cross-linked immature collagen fibers will be there. advanced protein-like structures, is binding to proteins that are non-collagenous in nature, as observed when the cementum of the tooth is in its functional stage. It's in the occlusion level. Non-collagenous protein that are seen in the cementum are proteoglycans, which referred as heparin sulfate, chondroitin sulfate, keratin sulfate, active proteins, cell and matrix interactive proteins. The unique to cementum-like proteins are derived attachment proteins and cementum-derived growth factors, which are most commonly used as the short forms for CDAP and CDGF. Others regulatory proteins for mineralization includes osteopontin followed by bone sialoprotein, alkaline phosphatase, bone-eating proteins like dentin sialoprotein, osteonectin in traces have also been seen in the ground substances making the composition of the non-collagenous proteins is the other half part of the organic matrix of the cementum. Any questions still here? It's easy revision. Right, Dr. Nupur, Dr. Panorai, Dr. Sakshi. Have you? Sakshi is so bored today. My God, I'm not having any smile from Sakshi. Nupur smiled, Panorai smiled, Sakshi also smiled. I thought my cementum is so boring. Huh? Okay, by now we have two cells for the cementum. Cementum forming cells that are cementocytes, cementum eating cells class. The magic rule you remember? Wherever the sites terminology will come, it's something that is being deposited or formed. Wherever there is class-like terminology being added, it is like something is being eaten up, right? So cementocytes, you can see these dark bodies with these hairs turned to only one side. That means they are depositing the cementum on this side where my arrow is. If these bodies would have been on the vice versa side, cementum would have been deposited there. These are nothing but canaliculae. They are also located into the lacunae in which bone forming cells like in the bone in the lacunae were present. Okay, cementoblasts are incorporated into the cemental matrix, proteoglycans, organic matrix substance. It is right. Numerous cell processes, as you can see, these hair-like structures directed one way. They are canaliculae. They tend to anastomose with each other. They are also being increasing the permeability of this cementum. Remember? So they are directive towards the periodontal ligament, outer surface of the anatomical root, from where they are also deriving their nutrition, vascular supply, etc., water, electrolytes. They are depositing the cementum. So these are cementoclasts. They are giant cells, multinucleated cells, as you can see here. In resorption of the cementum only. They are trained genetically for so. But cementocytes, which are embedded in the cementum, they are neither producing the cementum, neither they are resorbing the cementum. They are considered to be the cells of unmineralized layer of the cementum. Calcifying, new layer will be formed and new cementicles will be produced. Cementocytes will be produced. It's the region in the lacunae which have got dormant cementocytes or cementoclasts. These forming the pre-cementum-like area just prior to the deposition of the cementum, where newly produced functioning cementoblast will be lined in one go. Okay, connective tissue fibers from periodontal ligament will pass through in these areas between the cementoblasts and the embedded portions of small embedding, cross-linking, sharpest fibers will be seen in the microscopic analysis. So now, most important in cementum that can be asked in MCQs from all of you is arrangement of fibrils. Arrangement of collagen fibril in the cementum, which is grouped as extrinsic fiber system and the intrinsic fiber system. In extrinsic fiber system, number one is the principal fibers, that is Sharpie's fibers. Number two is the fibers that are arranged perpendicular to the cementum. Now, intrinsic fiber system is considered to be more dense fibrils, which are arranged irregular within the cemental matrix, forming the major component of the organic matrix of the cementum, the intrinsic fiber system, based upon which we have classically cementum as radicular cementum or coronal cementum. Coronal cementum in human is restricted to the areas where reduced enamel epithelial is present, even in the erupted tooth. That means just within the vicinity of the cervical junction, cemento-enamel junction. Next is this radicular cementum, derivative of dental follicle, that is covering the entire dentine of the root. From cemento-enamel junction to the apex is considered to be radicular cementum. Radicular cementum is extending only partially into the apical foramen, where apical walls of the root canal are also covered. That's why whenever we are doing RCTs, Dr. Nupur, Dr. Panorai, Dr. Sakshi, we are leaving about 0.5 mm in the X-rays. Right? Why so? Because we observe that there is some amount of cementum, dead tissue present. If I'm going to talk about the cement of any cells, then the terminology is acellular cementum. It is said to be the first form cementum. Just the pre-cementum which is getting calcified. It is covering only about the cervical third or half of the root. Contains Sharpie's fibers, the principal fibers, and cross-linked fibrils, intrinsic fibers with organic matrix, but there will not be any cells. Might be some region of cementoid at end can be seen, but you will not see any cementoblasts, cementicles, or cementocytes. No canaliculi will be there. There will be no cells. That's why it is acellular cementum. It is formed just prior to the eruption of the tooth. Thickness of acellular cementum is asked in MCQs. It can be ranging from 30 to 230 micrometers depending upon the age changes. Cellular cementum, if I am going to talk about, is formed after the tooth reaches the occlusal plane.